Hi everybody, this is Michelle from Virtual Hand Care, your online hand expert. I had a request for a video on boutonniere deformities. That's what we're going to be talking about today. So a boutonniere deformity can occur from either a trauma or from rheumatoid arthritis. Basically what happens is the central slip or the tendon that helps hold your fingers straight at the PIP joint becomes disrupted. So if you have a cut or a laceration of some kind, it can actually cut the tendon that helps keep it straight, and you'll actually end up getting a deformity that looks similar to this. What happens is that tendon can no longer help keep the finger straight. However, there are lateral bands that are on the sides of the fingers that are normally more dorsal or more over the top of the joint. However, when that central slip tears, those bands will start to slip forward, and the force of those bands on the flexors kind of do this pull, almost like pulling on the reins of a horse, and that will help pull that middle joint down into flexion. And since there's no central slip there to help hold it in extension, those lateral bands will pull that joint down into flexion, and then you're not able to straighten it back up. Now, sometimes people can get a central slip injury just from a kind of a trauma to the finger, or a sprain or a strain or something. And they might feel like the joint doesn't quite feel right. It got jammed. I also hear that. And sometimes that central slip injury won't happen for a good 10 to 21 days after. And then all of a sudden the person might notice that they're having a hard time straightening their finger, and they're not able to straighten it. Arthritis or rheumatoid arthritis can also cause a boutonniere deformity as well, because of the synovial fluid and the joint fluid in that PIP joint can be destructive to those soft tissue structures. Now, it's important to have a hand surgeon evaluate your central slip or your boutonniere deformity, because there's also what's called a pseudo boutonniere deformity, which is usually from a hyperextension injury, so where your finger goes in the opposite direction, but because of the tissue structures on this side get disrupted or torn, the finger can contract down, and it makes it look like it's a boutonniere deformity, but it's truly not. So you really want to make sure that somebody is evaluating your finger to make sure they know whether it's a true boutonniere deformity or a pseudo boutonniere deformity. And then whether the central slip is torn to where it needs to be surgically repaired, or whether non-surgical treatment can help. So there's a test that they do for that, and it's called an ELSENS test. And what the doctors will do, they will test your joint to see if the central slip is intact. So you'll put your hand over a block or the table, and you'll bend at the PIP joint and then provide resistance, and you'll try to straighten at the middle, at the joint. And obviously I don't have anything wrong with my central slip, so I'm able to push through that and to straighten. A central slip rupture would be very weak, so that could potentially mean that it's not torn all the way, but it's potentially getting there. So it would be very weak and unable to sustain full resistance, or even unable to strain all the way through that. If resistance is applied and a hyperextension of the DIP joint is noticed, then that is an indication that there is a central slip rupture, because you have no central tendon keeping the finger straight, but the lateral bands are recruited now to help try to straighten the finger. And those lateral bands have an attachment up to the DIP of the finger. So it can get a little confusing. So it's really important to just make sure that somebody will evaluate your finger to be able to give you a true diagnosis. Now, conservative treatment of a boutonniere deformity is to keep the joint completely straight for around 4 to 6 weeks, and usually it's more 6 weeks. So your surgeon may send you to a hand therapist to make a splint for you to help keep your PIP joint straight. And most of the time, the therapist will make you something similar to this and will allow you to bend the tip of the finger, but not bend the middle joint. So you'll have to wear that for a good 6 weeks, and you'll have to wear that 24/7 so that there's no bending whatsoever at that middle joint. So you can get that central slip tendon that helps straighten your finger back down so it can scar back down to its original insertion site. But if you go to take your splint off and you go to bend it again, you could just pop that right back off, and any kind of scar or healing that you have going on is down the drain. Some people will use what's called like a 3-point splint, kind of like a little ring like this, to help block. I'm not a huge fan of these, but if that's your only option and you want to try it, it is a possibility, because it doesn't have much to it, and you do want to make sure that you fit it right and fit it over the PIP joint so that you're not bending at all. And sometimes there's a little give with those, and also if you're very swollen at that joint, you might not be able to get this on or off. Now, of course, if you have a rheumatoid arthritis, it's very important to have the hand surgeon look at your finger and determine what the best course of action will be, because it really does depend on how much destruction that rheumatoid arthritis has done to your joint and what the surfaces of the joint is like, what the integrity of your tissue is like, how long you've had it for. There's a lot of different factors that will determine the outcome of your boutonniere deformity. So usually if you have to have surgery and you have a central slip repair, which is also known as a zone 3 extensor tendon repair, you pretty much have the same protocol as if you didn't have the surgery. So you're still usually not quite moving right away. However, because it is repaired, you can start some very gentle protected motion in the beginning, and usually a hand therapist will be able to guide you and tell you how far you can move in those beginning stages of recovery. Let me know if that helps you. Like this video and subscribe to virtualhandcare.com. If you have a boutonniere deformity or other finger injuries, or perhaps you are just wanting to have a second opinion on your hand or your wrist or your elbow, go to virtualhandcare.com. Thanks for watching.